Sorry. Thank you all very much for coming to this, either online or in person. And we've got quite a full agenda today, so I would remind people who are presenting, please don't read through what you've written. I hope we've all read it. I'm sure we have, but we just want to highlight some key points of what you've written rather than the full thing. So if we can remember that, that'd be appreciated, because it'd be good to get through this meeting. So thank you very much. Okay, have we got any? Well, we have got some apologies.
Okay, so Charles Margetts, Susan Parsonage, Graham Ebers and Nick Fellows will be late.
Thank you very much. The minutes of the previous meeting, has anyone got any comments on them? Doesn't look like it. Has anyone got any declaration of interest? No. There's no public for question times. There's no members for question times. So we can go on to the first agenda item, the Berkshire Safeguarding Adults Board Annual Report. I think Lorna Pearce was going to introduce you, Keith Brown, so I'll let you do that, Lorna.
Thank you. Thanks for inviting us along to talk about the annual report. Professor Keith Brown is here with me. He's our independent chair for the Safeguarding Board, and he's going to present the report to you. But I'm also here just in case I can help with answering any questions anybody may have. So over to you, Keith.
Thank you, Lorna. And sorry I can't be with you in person like last year, but I hope I bring positive and good news to you as a council and health and wellbeing board. I hope our report speaks for itself. A couple of things I'd like to bring out really are the voluntary sector and the areas of celebration and emerging issues. We are really driving, I think, very well working with the voluntary care sector. So that's a really good thing and a really positive thing that's going on. And the other thing that we are stating in our report is our desire to work more closely with other partnership boards in the West of Berkshire area. I think in particular, health and wellbeing boards like yourself and also community safety partnerships. We increasingly believe that much of the safeguarding agenda that we're dealing with in the safeguarding adult boards also spills over into those sorts of boards. And we're determined to try and work more closely together in the coming year. And finally, I guess, I think before we take any questions from you, hopefully, I'd like to sort of really ask you as a Health and Wellbeing Board how you believe the Mental Capacity Act impacts on your work as a board. The reason why I raise this is that the Mental Capacity Act, and sometimes of a lack of understanding of it and lack of application of it, is one of the major things that we constantly hear about in SARS, both in this area and across the country. So I'm just interested for your views really as a Health and Wellbeing Board, how you feel the Mental Capacity Act impinges on your work and your thoughts and your reflections. I'll pause there now, Chair, not to overdo the timing for you, and happy to take any questions.
Thank you very much, Professor Brown. Can I just ask, are you saying often we're saying people have capacity when they don't, or they have capacity at times and don't at times as well? Is that the problem with how we interpret the Act?
Thank you for the David, for the clarification. I think it's more than that. I think it's more often staff don't understand what the Act means and make assumptions sometimes that people have capacity, or make assumptions that people don't have capacity, and they don't understand the nuances of the importance of a lasting power of attorney and what an attorney means, and they don't understand really what a best interest assessment means and acting in the best interest means. So it's those subtle understandings of the roles to be played within the Act.
Thank you. Is there any question?
Mine isn't a question, just an observation, really, Keith. I just wanted to warmly welcome your comments on partnership working with the voluntary and charitable sector, and also the ambition to work more closely in partnership with other bodies. I think that is the way forward. So I'm very, very pleased to hear you saying that. Thank you.
My pleasure. I'm absolutely committed to that. In fact, my view is that boards are sometimes very good at understanding the works of the major welfare state providers, but often it's the food banks, the charitable groups, the good neighbour schemes, people like this that are often really holding communities together. And I'm really very keen to make sure we keep hearing their voices.
You may or may not know that this is something that we're also very, very keen on too. As a council, we are pursuing the partnership agenda very strongly.
I didn't know that, but I'm delighted to hear it.
Thank you. And thank you for your report. I'm going to ask a question based on this capacity issue. Perhaps it's for Lorna to answer more than you or even Matt. It's about what training we give staff in this area to understand it. So that, and then the second point is you've got some information in here about the safeguarding adults reviews that have taken place, and I wondered if you could just say a couple of words about whether you have any concerns that we're not doing the learning or we're learning the right things and doing the right things moving forward. Thanks.
Hey, did you want me to speak to that first, Keith? And
please, Lorna, do.
Yeah. So mental capacity is one of the areas that I think is most challenging for the system in terms of safeguarding, which is what Keith alluded to. We've invested heavily in training our staff in the Mental Capacity Act over the years, but what we've looked at across the last 3 years is really digging down into understanding what the barriers to implementation are and then adjusting our training strategy to address that. So about a year ago, we actually changed the content and the lens through which our training was being delivered to make it much more about actual application of the Act. So historically, like many agencies, we'd focused on the theory of the law. What does it say? What are you required to do? About a year ago, we went more into how do you apply that to a range of scenarios? And that's really helping our staff, I think, when they're faced with unique or different situations to really kind of unpick it and think about, well, how does this now apply? Alongside that, we've set up a mental capacity forum for our staff where they can bring cases that are challenging them in order to have kind of reflective sessions on them and explore different ways of them working with that. The focus for the next year, which we're going to be looking at delivering through our bite-sized learning programme, is around mental capacity and executive functioning, because that's one of the areas that is particularly challenging for professionals. So we picked that up out of our thematic audit, and we're going to do a deeper dive into that over the next year, which hopefully will, again, sort of enhance practice to the next level, really. Your second question about safeguarding adults reviews, I think if you look nationally, often people do express the concern about the same lessons coming out of safeguarding adults reviews. We do get some of that in the west of Berkshire, but what I feel we're very good at in our SAR panel is really looking at how can we get deeper learning from each SAR. So I could say to you, yes, the Mental Capacity Act always comes out in every single safeguarding adults review, almost without fail. But rather than set our terms of reference for that learning review in order to just repeat exactly the same learning, we look to work quite strategically to extract deeper learning each time, to refine the learning and therefore refine the actions we take to fill the gaps. Does that answer the questions?
I think so. I was particularly looked at that because of the reference to Louise, which is very much about mental capacity and the fact that she was clearly, there was self-neglect, but it wasn't kind of picked up properly. Yeah,
and I think that overlaps with the executive functioning element I was talking about as well, because that's one of the challenges in cases with self-neglect is sometimes somebody can talk the talk, they can give you the answers that you would expect to get, but they can't then necessarily use that information to actually inform the actions they take. And that can be quite a challenging area for professionals to unpick.
If I could come in just to support Lorna, I think you as a council actually do a very good job. One of my problems, I think, as the chair of the board, is that quite a lot of the care and the care system isn't actually always provided by you as a council. It's the private sector, the voluntary sector, the healthcare sector. And I think the council's done a great job at trying to train its staff and really trying to make sure that the other sectors are doing as good and as well. Slightly concerns me, and I have raised this with your local university. I'm wanting assurance that people on 3-year professional health and social care education professional programmes are actually trained and assessed in the Act. It worries me that there are far too many people coming out of 3-year undergraduate programmes still with a lack of understanding of these issues. And so I think we need to sort of challenge that university sector as well as seeing it as an uphill CPD situation. And on the final point about how do we make sure learning from SARS is embedded in practice, Lorna alluded to the fact that it's really very important, and I think we do really well in the West of Berkshire. I think we're hopefully going even further. We've just had agreed a slight increase to the budget to the board, which I think is amazing in the current economic times we live in, and that post will be to help support the quality assurance systems and our quality assurance endeavours to make sure that the learning has actually been embedded in practice from the SARS. Because I am, just like you, really very concerned that it's not about learning the lessons, it's about making sure the lessons have been implemented and made a difference. So rest assured on that.
Thanks, Dr. Milligan.
Hi, for those of you who don't know me, I'm Debbie Milligan. I'm a GP in the area. I just wanted to also pick up what you said about the voluntary sector. As a GP, it is often volunteers, the neighbour, the hairdresser, whoever, who highlights a concern. And Phil and I were at a meeting the other day when we were talking actually, our voluntary sector are now dealing with really complex care that previously would have been seen either by ourselves or other nursing or social care teams. And it's how do we support them when they're not quite sure where to go, and also, let them offload, because some of these are really difficult and harrowing cases sometimes that, they just walk into because they're befriending. So I think it's really important to not only think about our own staff, but the staff we are employing to support our people within the borough.
I couldn't agree with you more, and it's probably why I want to have this commitment to the voluntary and community sector, at least to make sure they know we even exist as a board and they know how they can reach out to us for help and support, that we even exist. Wearing another hat, in 2 weeks' time, I'm presenting to Parliament my work on food banks and the impact longitudinally of food banks in the city of Southampton. And volunteers in Southampton are contributing 4.5 million meals, pounds worth of meals, 1.5 million meals per year. And this sector is often completely not necessarily overlooked, but just not seen. And I'm really confident that we must do more to make sure that people like Philip, and he knows that I personally chair the VCS subgroup to try and make sure that we are hearing from these people. And my commitment is to go out and meet them. So it will not be perfect, but rest assured that we're doing all we can as a board.
Philip, you've got your hand up.
Yeah, thank you, Chair, and thank you for the presentation. I suppose you're absolutely right, and to Debbie's point, that we are seeing more and more complexity within the voluntary sector as statutory partners are ever stretched. So, Lorna, we've done some creative work in the past around training for the voluntary sector. I wonder if one of the actions we could take from today's conversation is to have a conversation around how we can gift suitable training to the voluntary sector locally to ensure they're suitably kind of appraised and know what to do if they're worried. And I think if we can achieve that together, then hopefully we will we'll have a workforce that feel confident, but also we're signposting promptly those individuals who perhaps are most vulnerable.
Absolutely, that's no issue at all, Phil. You know, we're always keen to support the eyes and ears in the community and embed prevention that way as well. So just give me a call.
I will. I shall email you. Thank you.
Thanks.
Okay, thank you very much, and thank you very much, Professor Brown, for being short and sweet, but also for the questions, because I think it's been good to talk, and certainly there's some outcomes from those questions, which means we're going forward, which is positive, and what hopefully this will always be about. So thank you very much indeed.
My absolute pleasure. I'll leave you.
Okay, so now we've got the Safeguarding Children's Partnership Annual Report, and that's David Pusey.
Thank you. I am here to present our annual report for 22-23. Seems like an awful long time ago now, 22-23, so might have been here a bit earlier. I hope it contains a summary of what's happened in the partnership over that 12-month period. Maybe Keith indicated this when he was talking about the Adult Safeguarding Board. The partnership is the only partnership in England that has 3 local authorities in it. So it is unusual in that respect. And I'm not always convinced that the Department for Education properly understands the complexities that we are in, but it also presents us with, I hope, a range of possibilities that are maybe not available in other contexts. That is the opportunity for wider work across the 3 local authorities of Wokingham, Reading and West Berks. Certainly in respect of one of the key issues that crops up for us in safeguarding children, which is harm done to children outside of the home, extrafamilial harm. We know that young people who are being exploited and who are involved in serious youth violence don't recognise geographical boundaries and the conveniences of local authorities. They do move around. So the issue of collaborating with our neighbours is really, really important. And we've set out some early steps in 22-23 to look again at how that collaboration should be done. I stress its complexity. No doubt this time next year, in terms of reporting about the current year, I'll be talking to you about much more progress, because more progress has been achieved. And I'm really pleased to be able to say that the 3 local authority chief executives for the 3 boroughs are working collaboratively with our local police commanders and the ICB on looking at that strategic alignment of what is effectively 3 strategic policies for dealing with child exploitation and serious youth violence, which one might argue is probably not straightforward, it's not helpful, but we do recognise that there are single governance arrangements in the local authorities for looking at those 3 things, those 3 spaces. So work done to align during that year, I think, was started, it's continued. We've certainly done some further work on looking at the thresholds for statutory intervention across the 3 local authorities so that our common partners in health and the police particularly have the same set of standards applied across the 3 local authorities. And I think there is learning that has emerged out of a series of local child safeguarding practice reviews, again, across the 3 local authorities, but with some common themes, which I think would be around the need to improve the assessments of risks to children, and looking at the use of chronologies, the histories that children bring to their current circumstances in some more detail, thinking about how we step down cases from that statutory point into lower levels of intervention, Nobody will be surprised to say that information sharing should improve. I think the first inquiry into the death of a child in England was in 1945 with Dennis O'Neill. It talked about information sharing, and we've been talking about it ever since. So I think continued work is inevitable in that respect. So I think a busy year overall, much more to be done. And I think the work at the chief executive level to bring the 3 local authorities with our common partners together, I think is very helpful.
Thank you very much, David. Have we got any questions?
Not a question, but I'd just like to thank David for all his work. He's made a distinct difference to the partnership since he's been in post, and we're very grateful to have him. I'm quite familiar with the work of the board, and we've been through the reviews and the learning from that, and we keep a very close eye on the progress on improvement plans and so on that have resulted out of it. But yes, this year will be an even more interesting year to report back on. I think a lot of progress made in a lot of directions.
Thank you. Andrew, sir.
Yeah, thanks for the presentation. You've alluded to that there's things are improving. I guess I don't want you to leave the room without saying without me asking, you know, what's the 1 or 2 things that we can do to help improve further? Like what do we around the table need to help?
Sorry, apologies. I think I'd probably say it's about ensuring that the barriers to alignment across the partnership are as small as possible. I don't detect territorialism in respect of how the 3 local authorities work together. And I'd like it to stay like that in a sense. When it comes to aligning strategy around, for example, child exploitation and serious youth violence, each council, as is the ICB and the police, they've been charged with a duty under the Police Crime Courts and Sentencing Act to reduce serious youth violence. So it's a duty owned by you as a council. But it's a duty in a sense that can only really be effected in collaboration with other institutions and authorities. And each local authority has its own community safety partnership arrangements. And serious youth violence and child exploitation, in a sense, are also owned by the Safeguarding Children Partnership in terms of our purchase over some of those issues. So we've got a contested space. Community safety, Safeguarding Children Partnership. Public health is involved here too in respect of public health responses to serious youth violence. Police for the wider health contexts. We need to be coherent, I think, across those individual governing spaces about what it is that we all want to do together to make a difference. In some spaces where there is one Safeguarding Children Partnership and one Community Safety Partnership and one local authority, it's difficult enough, but we've got a broader context here. So my ask would be that there is a willingness at this level to make a coherent whole out of all of those ingredients. Because I know that child exploitation and serious youth violence is a very dynamic set of activities. It moves inexorably and it's very difficult for us all to keep up with it. And that's just one aspect of child protection, an important one. There's a whole host of other stuff that goes on in respect of looking after the safety of children in their own homes. But this one around child exploitation and serious youth violence, I think it's a much broader set of activities that does really require partnership.
Thank you. Councillor Conway.
Thanks very much, David. And thank you, David, for the presentation and also all the work you're doing. Just a second. Bruce, thanks. Just on that question about the three local authorities concerned working together more closely. Just a kind of broader context to put this in, I think there are currently very good relations between not just the professional leadership of those councils, but also the political leaderships of those councils. We do cooperate with Reading on a lot of different things, moving away from the area we're focusing on this evening, just onto a range of areas of common interest. West Berkshire, we probably have rather less common interest, because our boundary, although it looks as big as our boundary with Reading, in reality, Reading and Wokingham have more close connections. And West Berkshire almost inevitably doesn't just look east, it looks north to Oxfordshire. So the dynamics of that relationship are somewhat different, but they're still close. So I can't give you absolute reassurance, but I can give you some confidence that there is, within the political leadership of all three of these councils, a willingness to work together. And that's exemplified by some of the work we're doing in the Berkshire leaders meetings, which we hold monthly. And we've gone so far as to be on the verge of creating a Berkshire Prosperity Board, which will enable us to bid for funding from central government much more effectively than we can do as individual councils. So I think there is, on lots of levels, an appetite for working collaboratively. And that is the key, as you quite rightly underlined. So I think the will is there.
It's really good.
Hi, I'm a local GP. I'm going to ask a question about, do you ever, when children have got through the process and are adults, do you ever ask them what went well and what could have been done better?
I think, apologies. I think there are activities in each of the three local authorities for those children that have been certainly looked after, where that information is collected. But as a partnership, I don't think we have a good enough understanding of what those voices are telling us. In fact, I'd go as far as to say that as a partnership, I don't think we've really properly captured sufficiently the voice of children across a range of issues. This time last year, I think it was this time last year, reporting to the Children's Scrutiny Committee, and there was a presentation from the Youth Parliament. And one of the things I wanted to do was to bring this report this year to that Youth Parliament, because I think we owe them a duty. And that's part of a programme, I think, of hearing those voices. But I'm also concerned that children that probably attend a Youth Parliament are not necessarily the children that we really need to hear voices about their lived experience from.
I think it's just those children that, you know, some adults are quite cunning and they can play the game. So we have them, you know, on our radar, and they tick all the boxes they need to tick to come off for a period of time, and then something else happens and they go back on. And it's those children, you know, if you could just key into them and just say, what could we do, or what were the warning signs before this happened again? Because these are often the children that end up dead, aren't they? So if we get children through the other side, it would be quite powerful to know. I'm not saying it'll be easy. I'm not a psychiatrist. I don't know how we would kind of do that, but I think their lived experience would be very powerful.
I completely agree. And I think I don't want to wait until they get to the other side. I need to understand what those voices are telling us now. And these are, by definition, some of the most vulnerable and therefore difficult to access children and young people in terms of their voices. We can glean some information, I think, from demeanour, from behaviour, but bringing together a much more thematic, properly understood analysis of those voices, I think, is something that we still need to do. I think I know what they're going to tell us. I don't think any of us are blinded to that, but we still need to hear it.
Thank you. Councillor Bray.
Yes, sorry, just to pick up on that point. Last night I had the interesting experience going to the Children in Care Council to talk to them, to hear their voices. That has come on in leaps and bounds. I remember within the first couple of months of becoming the lead member for Children's Services, Helen and I attempted to have a meeting of this thing. Well, we got 2 children who ate pizza and didn't really talk to us. Last night was a lively meeting, I think we could say. There's about half a dozen. There was still pizza, but there was half a dozen children. Could not shut them up. I mean, they had lots to say. They communicated very well. I've made some notes which I've passed in. They will be brought up at the Corporate Parenting Board, which is where we look at children care. And a lot of it, what I was pleased with, the most the best part of it, as well as being a much better body for expressing their opinions, was that they all said that now they're in care, they feel safe and they are happy with their foster carers, and everything is going well for all of them. But they did make a number of points about the journey along the way and some perennial things that came up, which are a constant source of irritation to them, how many times they have to tell their story. And that's something we just don't seem to be able to quite sort out. But other things about interventions in the past that didn't work or that didn't actually happen when they disclosed something and it didn't go well. The adult that they disclosed it didn't react in the way one might have hoped or they hoped at the time. So there are lots of lessons. So we're on that journey trying to get that voice, and the voice of those children is really, really important. Yeah, we are listening as hard as we can, and we're trying to reach the most difficult ones to get at. And that is a really quite a challenging thing to do, but we're doing our best with it.
Helen Watson.
Yes, thank you, and good evening, everyone. I fully agree with everything that David and Prue has just referred to in terms of the voice of children and young people. Just to assure the committee that when we undertake file audits of cases, we do actually speak to children and young people and their parents and carers about their views, what has gone well, what could be improved. And, I totally endorse everything that Prue has said. The only other thing I would add is that David, I wondered if you were going to reference working together to safeguard children and the changes that are coming in now. So we've had a raft of new policy documents from the Department for Education that arrived in December. And the key one for this conversation is working together to safeguard children 2023, and the partnership will be and is actually now currently working through the implications of that. So quite an interesting change going forward. Thank you.
I could wax lyrical about the government's proposed changes. I was trying to stick to 22-23.
We'll hear this next year. Thank you. I think that's all the questions. Thank you very much indeed, David, for your presentation and what you've written. It's been very interesting. And thank you for all the work you do. I mean, certainly Prue is very positive about all the work you do. And it can't be easy having 3 different authorities, however much they work together to look after. But thank you for what you do. Okay, we've got Anna Richards now looking at the Wokingham Inequalities Project. Thank you, Anna.
Hello, good evening, everybody. My name's Anna Richards. I'm a consultant in public health, based within the public health team in Wokingham. But I've come today to talk to you about the Inequalities Project, which is a broader sort of cross-council project. So here on behalf of the Inequalities Steering Group, and in particular, I want to mention my colleague Sarah O'Connor, who's Head of Communities and Partnerships, who I work very closely with on this work. This is the first time I've attended this board, so I know some of you, but not all of you. And my understanding is that there's an expectation that people have read the papers in advance of the meeting. If possible, I would just like to highlight a few points just to give some context to the discussion, which I hope we have. So I think the first point is, why are we doing the Inequalities project, and why is it coming to this board? So the purpose of the Inequalities project, there is a narrative around Wokingham. From an average perspective, it is a very wealthy and very healthy borough compared with other parts of the country. But I think that overarching narrative doesn't necessarily explain what life is like for everybody in Wokingham, and there is variation. So not everybody is experiencing that wealth and that health equally. So what we want to do, sort of in the broadest sense, with the inequalities, is to really understand that narrative, that picture of variation, and in particular to understand what will make a difference so that everyone in Wokingham can thrive. The PowerPoint that I've shared with you, there's a key statistic in it. There's lots of statistics and numerical data that we could present around inequalities, which are unfair and preventable differences between communities. The one that I've shared looks at life expectancy, and it compares life expectancy for people in the most deprived compared with the least deprived neighbourhoods in Wokingham. And it shows that on average, people living in our most deprived neighbourhoods in Wokingham are dying 5 years earlier than people living in our least deprived neighbourhoods. And that's an unacceptable difference. And that's something that we want to change, that we're doing a huge amount of work already on to try and change, but we want to work further on to understand and to reduce that variation. The underlying factors that determine how healthy somebody is, how long they will live for, and the quality of life that they will have is complex. And again, in one of the slides, what I've tried to highlight is those various different factors that influence people's health and well-being. And I think the really important sort of take-home point is that the most important sort of group of factors that influence health and well-being are the environment in which people are born, live, grow, work, and the opportunities that they have as a result of the environment that they live in. And a really key document that I've really found very helpful in my own personal thinking around this area comes from the Health Foundation. And again, I've shared that slide in the pack, and it starts to describe these building blocks of health and well-being. What is it about the environment and the opportunities that we have that has such a profound impact? And I think thinking about it as a set of building blocks is really helpful. So there's things like education, things like access to good employment that pays well, access to good transport, having a roof over your head, the networks, the family, the friends, the communities that surround you, but also the physical environment in which you live. So all of these things have a profound impact on people's health and well-being and whether they're able to thrive. So we know that for some people, these blocks are not as stable as they could be. And the purpose of this project is really to try and understand what those building blocks look like, feel like for people who are living in Wokingham and living under more challenging circumstances. Another slide in the slide deck just outlines the 5 sort of work streams that we're going to be focusing on for this project. It's running for a year, sort of summer, started the summer last year and running to the summer 2024. We've finished 3 of those aspects of the work, which is about looking at the data, the numerical data to describe that variation around the building blocks. And I'd be very happy to come to a future meeting to present that. We've also looked at the literature around what it means to be relatively deprived but living in an affluent area. What's the impact of that on your health and well-being? And we've also worked to link in with the Institute of Health Equity at University College London. And as you may have seen from the recent full council, we will now be taking within Woking a marmot approach, which is very much thinking about those building blocks and how we develop them to support people's health and well-being. And again, very happy to come and talk about that further. The main piece of work that we've got left, which really speaks to the conversation that you've just had around children and young people actually, is to talk to people, to get that understanding both from residents and frontline staff around what are the building blocks of health and well-being, how do they look, how do they feel for those people in more challenging circumstances. I've outlined in the slide deck the frontline staff that we're going to be talking to, but also the residents that we're going to be talking to. And in terms of deciding which residents we'd like to invite to participate in this discussion, we've really focused on the health and wellbeing strategy, which is the basis of this board, and looking at those 5 groups that you've identified as priority groups for the health and wellbeing strategy. So that's people with learning disability, unpaid carers, young people in contact with the criminal justice system, people with lived experience of substance misuse, and people with a lived experience of domestic violence and abuse. And we're also going to be talking to people who are identified in our Wokingham Tackling Poverty strategy as well. So they're people living in persistent hardship, those who are just about managing, and those who are asset rich, cash poor. So the next phase of the project is really to start having those conversations. We've commissioned a provider to do that, and we've commissioned a provider that's going to take a very creative approach to having those discussions to really enable people to feel included and to be able to express their thoughts about the building blocks of health and wellbeing and how they look for them. So that's a sort of whistle-stop tour of the project. I'll pause there and very happy to answer any questions that this board may have. Thanks very much.
Thank you, Anna. We've got Councillor Cole.
Thanks, David. Thank you very much, Anna, for that presentation, which was very helpful. You did successfully highlight, I think, some key things for us to focus on. I just wanted to really comment rather than ask questions, I'm afraid. And I hope going to be entirely supportive comments, some of which you're probably quite fully anticipating. The first was you referenced, and the report and your presentation referenced the council's recent adoption of a commitment to the Marmot principles, which I'm sure we're all very keen to follow through. And from my own perspective, the housing element of this is vitally important in terms of promoting health equality. It's not just a question of having a roof over your head, it's the quality of the housing in which you live. Housing that's damp or impossible to heat without great expense is certainly, contributes very clearly to health inequalities. One thing that perhaps hasn't featured in the report or your thinking so far is there's a happy coincidence that one of the emerging themes in the work we're doing on a community vision, this is our attempt to bring forward a set of priorities that the council should have in mind as it draws up its next council plan, setting out its strategic objectives. The community vision has involved working with a lot of stakeholders in the local community so we can get a borough or community vision of what people want for the future. And one of the key emerging themes is greater equality. This is slightly surprising in an area like Wokingham that was highlighted, but it was very clearly emerging as a consistent theme in all of the responses we've been getting. So that chimes very nicely with what you're doing here, I think. So that's may be worth trying to build in and reference at some point. And of course, I warmly endorse any relationship with UCL, which is, of course, the best of all institutions. So thank you.
That's great. Thanks for your comment, and I absolutely take on board your point about housing. It's not just about having a roof over your head, it's about the quality of that roof that's over your head and the quality of the housing that you live in. So absolutely spot on there. Thank you.
I wonder why UCL is so important, Stephen. Sarah.
Thank you. Hi, I'm Sarah from the NHS ICB board. So really really welcome this approach. And I think the presentation sets out why it's so important that we are working in partnership, given the impact of those wider building blocks versus actual clinical NHS services, really. So I just wanted to also ask, in terms of the insights from frontline workers, we've got our community wellness outreach service that's just starting up at the moment, and we'll hear more about this at the next board meeting, I think, but that's where we're taking sort of health and wellbeing checks into the heart of our communities most in need. And I think the richness of feedback we'll get from that team as well will really help to inform this work that you're doing and the wider Marmot approach as well, which I also am really excited about working on that with you. So thank you.
Thanks very much, and nice to meet you.
Alice.
Hi, Anna. Can you hear me?
Hello again. Hiya.
Hi.
Yeah. Nice to see you again.
I just wanted to find out from you, in the sense that the criteria that you've had, like people with learning disabilities, unpaid care. When in Wokingham, I know for a fact that there are communities that are struggling to get hard to reach. They're called kind of thing. So why are they not? I'm keen to understand from you why they are not highlighted in this document as such, because in every document that you look at health inequalities, the ethnically diverse community is one of those communities. So it'd be nice to hear from you to see why they are not part of it, because in the health and well-being strategy, they are one of the identified cohorts.
Yeah, thank you very much. So I think in terms of it was difficult defining those cohorts for the residents who would participate, and I suppose we proactively decided to build on the discussions that had already happened in terms of the priority groups from the health and wellbeing strategy, and also from the tackling poverty strategy. We've also made a commitment to work with the Equality Forum to understand how we can make sure that those protected characteristics, including ethnicity, are reflected in the people that we are going to be having conversations with. And we'll be recording that information as well in terms of protected characteristics as part of the piece of work, so we can understand how diverse by protected characteristics the people participating in the discussions are.
Thank you.
Yes. I'm going to get a bit slightly political now. Sorry, Stephen. You'll probably know that the government recently announced a little bit extra money for councils in response to local government settlement. And we've had a letter from Michael Gove saying we're getting a little bit more money, some of which is targeted at adults and children's, and some of which is not so targeted. In the letter that Michael Gove sent to us with that information in it was a reference to expecting councils to do performance reporting in the summer, and to something which he labelled discredited equalities and diversity strategies, or words to that effect. I'm not quite sure what he meant. I think I would like to put on record that I do not believe this is one of those, but it's hard to know. And I think somebody should try to find out what it is exactly that he thinks has been discredited to do with equalities and diversity. But I found that sad and unhelpful, and I think it is really important for all the reasons Stephen has articulated, not least that our residents appear to want us to do more on this front. that the government should be putting out such a negative message about equality and fairness and diversity and this kind of project that we're embarked on is so important for our residents, for the health, and not least, if you want to take a really hard-nosed attitude, for the resources of the health service and the council and the voluntary sector to be able to deliver our services effectively by helping everybody to have the best health that they can, so that we don't have to deal with so many chronic and acute conditions and spend millions on diabetes and all those other things that we have to do. So I don't know which officer would have to go and look at that, but I think we need to find out what he's aiming at in some way, in a subtle way. I'm sure they'll make it plain to us at some point, but meanwhile we must persist with this because it's really important.
Stephen.
Indeed, we must persist with this, and you don't need to apologise for me for being political, because I think that's a perfectly acceptable thing to say. But my initial thought on this is we don't need to do anything different from what we're doing now. I have no idea whether these conditions attached to this rather modest amount of extra money will be thoroughly investigated and we'll be required to report on. I suspect not. But if we are, there's a very obvious response. None of this in our context is in any way discredited. So I will hang on that word discredited. It's not discredited. So that's the end of it. So I don't think there's any reason we shouldn't just press on with this. It's immensely important. As you say, it reflects what our residents want. It also reflects what the council wants. The council endorsed the Marmot principles, not just current administration, the council. So I don't think there's any reason we cannot just press on and ignore what little noises there may be coming from the government.
It does occur to me there may not be the government much longer.
Thank you very much, Stephen. And I must agree that I think the Marmot principles are imperative to work out in this area, as in any area, because often being poor in the rich area is harder than being poor in the poor area. So,
Yeah, can I just say that I'm really pleased that you've picked up on the people who are asset rich and cash poor. Sadly, these are particularly our elderly that don't like to ask for help in the first place. But I've been aware of a number of people who are choosing between food and heating, or actually even more of a concern, who have actually stopped carers because they thought they've had to pay for their total care because they've got a big rich house, but they don't actually have any money in the bank. So these people are literally ending up in crisis, and then obviously in the Royal Baths, and sadly not doing very well.
Yeah, thank you. I think that's a really important point to make, and we're working closely with the Hardship Alliance to understand how best, and the voluntary and community sector, to understand how best to reach those residents, but also working very closely with colleagues across the council. The steering group that we have contains representatives from a wide range of directorates and services, including, for example, adult social care. So talking to them very closely about how best to include residents, and yeah, that's a really helpful comment. So thank you.
Yeah.
Sorry, can I just follow up on that? I think one area that I've been kind of more aware of is the care costs and everything. And there is a misconception that if you've got more than £23,500, you have to pay for your care. And a lot of people think that because they're in their own home, even though they're having care in their own home, their house is part of that cost. So I don't know how we can get that information out to people or make it clear, but it may be something that we just need to think about.
Thank you.
Thank you. Andrew.
Hi, I'm Andy Staden from the Royal Berks. I was going to make an offer really, but I'm going to make an offer on Debbie's behalf as well. Just if you want our staff, but also primary care staff to be part of that, who might be in contact with people who may not want to tell you, but we can give our take from that, from working with them as well. I'm sure our staff would be willing to give time. I suspect Debbie and her colleagues would as well. So.
That's great. Thank you very much for that offer, and I will no doubt be in touch to follow up. So thank you very much.
Thank you very much, and it's great to have again things coming out of our discussions and so on, which are practical and working together, and that's what hopefully this is about. So that's great. So thank you very much, Anna. And
thank you.
Yeah. Okay, so we go on to the Wokingham Send Partnership Strategy, and I believe that's Jonathan Wilding.
Yes, Chair, good evening. I'm wondering if I could just set a little bit of context to this and also introduce Jonathan to the committee who's leading this piece of work on behalf of the local area Send Partnership. The partnership comprises a range of colleagues, the local authority, a number of health colleagues from the ICB and provider organisations, schools and our parent carer forum, amongst others. So what we're hoping to do this evening is provide an update of the strategy refresh that is being undertaken now. So over to you, Jonathan. Thank you.
Good evening, everyone, and thank you for inviting me to speak. Delighted to be here. I won't go through the slides individually, as everyone's said. You've probably read them already, so I'll set the context more than that. The strategy we're currently working within started out covered the period from 21 to 24. That was written in the context of a poor Send a local area inspection, and was largely in response to that. Whilst there's been a lot of progress and activity to address some of those concerns raised in our Send inspection since that time, it was pretty much agreed by most partners that the priorities identified back then remained relevant now. I'll come on to what those are in a moment. But therefore, this has been a relatively light touch refresh of an existing set of priorities in a changing context. Things have undoubtedly changed. The world of Send has progressed nationally. We've got a new area inspection framework, which we launched earlier this year. We've got the government's Send an AP improvement plan. We ourselves, as an authority, are now within the safety valve programme because our financial situation has deteriorated since that last strategy period. But even given all those changes, many of the priorities underpinning that remain the same. I'll come on to what those are in a moment. It's worth saying that we had an early version of the document written last year. We did a lot of energy and time in dialogue with schools, with parents and carers, and with other partners, and had a first draft of this towards the end of last year. But particularly our health colleagues wanted to have a further opportunity to sort of co-produce and have an input into particularly some of the action planning around, the priorities are widely agreed, but in terms of the action planning as to what we do about those, we are currently in a slightly extended phase of co-production. We're having workshops with a number of partners to really flesh out the so what. So we know what the context is, we know what the priorities are. So what exactly are we doing together about those? So I was probably expecting to be coming here with a finished product when I first was asked to speak, but actually we're still in that last stages of really adding some of the detail. But I'll say a little bit more about what the priorities are, the particularly issues that are facing the area. As was the case back in 2020, sufficiency of provision is a key challenge facing the area. We don't have as much specialist provision as many of our comparators. Now, we have set about doing a lot about that. We have a new specialist school opened very recently, Oak Tree. We have a lot of new provision in the pipeline being commissioned, and we have 2 new specialist schools coming to the area, which are due to open in September 26. But in the current context, it remains the case that we have a rather low proportion of available specialist provision. Consequently, we have a lot of our pupils are in mainstream schools, which is to be applauded. But unfortunately, the other side effect of that is we have a lot of increasing numbers popping out of our own maintained system and going into independent, high cost independent specialist provision. That alone is one of the real drivers of spend that's really creating the financial pressures we're all facing. Now, there's a lot of activity underway to address that sufficiency, and I think many of you will probably be aware there's been a fair bit of coverage of some of those welcome developments. It's worth saying the last year we brought in total at least £16 million of additional revenue funding into the area, and the 2 special schools will add to that total. So a lot of new resources coming into the area to address that challenge. Having said that, even if we build all those schools, even if we had them now, without some fundamental changes underpinning the system, we will fill that provision and still not have enough. The main, perhaps, driver for change that we need to see, and what we're trying to really promote now, is earlier intervention, earlier prevention, and really getting ahead of that need, because we have many children probably now in special school who, had they had the right support earlier, would not have needed to go into special school. And we know that we can do more and do better within our mainstream sector, and our mainstream partners are really on side with that. But we are investing in services and support and additional provision to enable more pupils, more young people, to stay in their local communities, in their local provision, and that will certainly be the remedy. That's more of a remedy, frankly, than additional new provision. So those two pillars are 2 of the main pillars of the strategy. Moving on, this picks up many of the themes picked up earlier in the safeguarding review document. Joint commissioning and working in partnership, in concert between ourselves and our health partners, and social care, education, health, working really closely in tandem with each other. Also worth saying that the voluntary sector also can play their part in that, in terms of what happens out in the community. We know we need to get more closely aligned with health colleagues. I think that, as has been described tonight already, one of the challenges is the footprint. We're a relatively small area. When it comes to low incidence need, it's rather hard for the ICB to necessarily align just to a Wokingham boundary. So we have to get better at working in partnership with our neighbours to ensure we've got the right level of specialist provision for those low incidence, high cost placements. There's more to be done there. But also at the other end of the spectrum, that we get more joined up in what we would term our ordinarily available offer. That's what's available to every family right throughout right across the borough, in terms of early support, early help, access to things like speech and language, access to things like diagnostic support. And we are working closely with partners, but that really is a sort of a keystone of that sort of joint commissioning approach, and getting that more consistent, more joined up with shared language. Another one of the priorities is around effective transitions. I won't talk about that in length now, but really, when things go wrong, they often go wrong at the handover between one age range of provision and the next. So particularly primary to secondary transitions. If you get your transitions effective and right, you enable many more young people to stay in their local provision again. So we really want to zoom in on that. You see a huge rate of dropout or placement failure, if you like, around those transitions, and we can get better at providing support at those key points. So that's a theme in its own right. And finally, the final sort of key pillar of this strategy is around co-production and communication. We are constantly face challenges, I think, particularly in the parent carer community, around our ability to communicate with them effectively, and we are investing in that to improve that. It's a recurrent theme in terms of feedback from schools too. So we collectively will, need to invest and resource that better. But there's more to it than that. There's also worth setting the context. We are facing certain challenges. There's a lot of good work happening. One of the major challenges we're facing currently is really, particularly, I think, with the parent carer community, still a relatively high level of anxiety around the changes we're making, probably a legacy of some families who don't necessarily feel their children's needs were met well or early enough. And whilst we can certainly present a great story in terms of how we're addressing that and changing that, there is certainly, it has to be noted, a legacy of probably, and this is true nationally, it's not just a Wokingham issue, a legacy of relatively low level of parental confidence in the system at the moment, the education system at the moment, and we are doing our best to bring the parent community alongside us to see that there's a lot of investment, a lot of improvement on its way, and that Wokingham is certainly shifting the dial in terms of the level of support available. But we must acknowledge, and I think it's worth this committee being aware, that we do face, there's a lot of noise out there in the parental community, and Safety Valve itself has a mixed, it doesn't always have the best coverage nationally. I think our story locally is somewhat different. I think it's been a really powerful way of galvanizing change, but I just think it's worth making, acknowledging that we do still face challenges, and there's a lot of anxiety out there, and parents who tend to be rather suspicious of our motives. I think this is all about saving money, and we are making the case that this is about investing and improving services. But nonetheless, I thought it worth noting that that is the context we're operating in at the moment. I think, I mean, I'd say we had another thing to note. It wasn't in my presentation, but it's worth adding to the mix. We had a peer review, an LGA peer review just recently, and one of the key headlines from that was around that developing a sense of we-ness, a sense of togetherness, using language consistently between health and ourselves. I still think it would have to be acknowledged there's some way to go in terms of getting our messaging more consistent, getting our communication more consistent, and actually communicating as a partnership rather than as the individual entities within that partnership. And I think that will also help improve that level of confidence in the wider community and help. And we are focusing on that at the moment. But there's a lot of work underway, particularly between ourselves and health colleagues. And we're really, I think, making great inroads into some of those identified challenges we have. I think that probably summarises the headlines. Those are the headlines I thought I wanted to particularly highlight tonight. I'm happy to take any questions.
Thank you very much, Jonathan. Certainly very interesting where we're going, and we've still got a long way to go, I think. But something you said was about co-production, well, working with parents and carers and so on, but co-production is also working with children. Is that something that you're doing quite a bit? Because that's always so important to hear them and to see what they want.
Yes, indeed. We had a good piece of work led by one of our local providers, the Me Too Club, did some good research last year with a really wide-ranging group of young people with special educational needs. I think they spoke to around 50 to get their sense of what we were saying in our strategy, obviously in child-friendly language. And many of the key themes they identified were consistent, in fact, with what schools are saying and what our parent carer community is saying too. So we're certainly paying attention to that sort of child's perspective on their own journey. And that's also, it should be said, one of the key themes in the new inspection framework, making sure children and young people have a sense of agency about their own path through their education, through the education system. And we are really working hard to develop that and embed that, if you like, in the system and the way we work.
Thank you, and that's great that everyone's saying the same thing about the problems and where the good things as well. So that's quite very positive. We've got Sarah and then Prue.
Thank you, and thank you, Jonathan, for that summary. I think I just wanted to re-emphasise how important this is for us and the partnership working that we're doing at the moment. This is a priority for me personally and for my organisation in the ICB to get this right. And I mean, wouldn't it be great if we were just sort of one public organisation that didn't have these artificial boundaries that our structure sets us up for? Unfortunately, I think that's slightly out of the reach of this programme and this board, but our exam question really should be, how close to that can we get and make it feel that way to our parents and our children who are affected by this? So really welcome the work, the additional workshops that we're going through at the moment, the sessions we're doing on kind of immediate action planning as well as the longer term strategic planning, and kind of looking forward to carrying on working with you on this.
Apart from endorsing that entirely, and the work that we're doing with the schools, and I think the relationship with schools has changed as well and improved. I just wanted to touch on one of the problems that we have, which is getting people to understand what Safety Valve actually is. That it's not. It is not a. What we are embarked upon is not a programme of saving money. We are actually, we have financial challenges. We have to look at our SEND service through a financial lens, and that's what Safety Valve is. It's not about reducing the number of education, health and care plans. It's actually about trying to intervene earlier to prevent a child's needs getting worse, because that's better for the child, as well as actually it does save you money by working upstream rather than downstream. But it won't reduce the number of plans, it will slow the increase, which is an entirely different thing. But it isn't Safety Valve driving SEND improvement, it's the need to improve the SEND services that is driving our SEND strategy, because it's not good enough. And Safety Valve is just the financial lens to which we look at that. So the strands of work within safety valve, I think there's 16, I think, they are send improvement strands. They're not saving money strands. They have an incidental effect that when they're put together, they will bring us into a alignment with the actual money that we have in a better way. But it's about send improvement, not letting the children down. And I do feel that we are now working much more collaboratively. There is, genuine co-production starting to go on. The relationships are improving, and some of that will be available for people to see at the Children's Services Overview Scrutiny meetings, where this gets discussed in a more public forum.
Stephen.
Thank you, David, and thank you, Jonathan, for the presentation and the report on all the work that's going on. I just really wanted to add my voice of thanks, but also just to highlight some of the things that have been said and how important they seem to me. I mean, it's very obvious partnership working is absolutely integral to this, and I completely endorse what Sarah said about trying to get to the point where, from the perspective of those who are effectively receiving help, it looks as though this is a more integrated whole rather than a fragmented and in some ways dislocated system. So I think that's a noble ambition that we should endeavour to try and deliver. I also think a really important point is made about the purpose of all this, which is to improve SEND provision. Early intervention will save us lots of money. There's no question about that, but it also produces better outcomes for the children involved, which is the most important part of this. The saving money is, of course, desirable in our current circumstances in particular, but it's almost a collateral benefit of the fundamental objective, which is to improve SEND provision. So I think we have to try and find a language that presents what we're trying to do here in ways that overcome this parental suspicion, which I think you're absolutely right, is based on a legacy of built up mistrust over a long period of time. If it's any consolation, this is a problem that we encounter with lots of forms of partnership working. There is quite often an element of mistrust based on past experience. And it's quite difficult to persuade people that things are changing. We're trying to change things. We are working hard to improve. And it's only, I think, when people start to see tangible benefits, they will become entirely convinced. But I think we're definitely moving in the right direction, and I thank you very much.
Hi, thank you. Slight spanner in the works, so probably is, yes, I agree we need to be working together, the Borough Council and the NHS, but obviously we have borders around Wokingham, and practically that's where, as GPs, we don't know which way to go, and parents have no idea what to go. And it's some of these children who are preschool. We know they have severe autism, but there's a 2-year wait to be seen. They're not in school. They go to a school in Hampshire. They won't see them because they're not in school. BHFT won't see them because they're not over 5, and we're bouncing all the time. Obviously, we've got Surrey, the other border as well. I'm sure there's kind of issues with GPs, with people who are on the borders there as well. So, I think when we're thinking about a strategy, we need to test the system and say, right, okay, if this person goes through it, does it still work? Because we've got border issues that we need to navigate.
Thank you, Debbie.
I want to say something about this. I don't know if Helen or Jonathan wants to. We have, I don't know whether it's known to everybody in the video, we've just, after half term last term opened early years SEND provision at the Old Farley Hill Primary School. So we've got 16 essentially preschool children in there under the auspices of Addington. It's fantastic. I went to the sort of official opening. It's just wonderful, and there'll be another 16 children joining them in September when phase 2 of it is built. It's fantastic for so many points of view. It just helping those children. You can see them. They have the legacy of COVID and the isolation, as well as all the other things that happen, that's made it really difficult for them and for their parents to navigate around everything that they need and to realise what's going on with their children as well. And unprecedented numbers of early years children with needs that seem to be more I don't know how you'd word it. It seems to be a worse situation than it was pre-COVID. We are working with Dingley's Promise, and they are now the DfE SEND advisors for preschool for early years children, which is really good. And I think we've actually now got the official go-ahead that we can work with them. That came in either today or yesterday, so that is really good. So we will be talking to them. Catherine McLeod has already said she'd really welcome the opportunity to work with us. So we will be looking at that. But these border issues are difficult. Part of the difficulty is getting the information to people. That's why one of those priorities is in there about communication. And in one of the strands of work is improving the local offer. And the local offer is what we provide locally, but it's how you communicate that local offer that we're working on the improvement of. So we've had somebody relatively recently come into post and has been beavering away at that. So there will be significant improvement in that, but communicating more widely exactly what's going on, how you navigate the system is one of the crucial pieces of work.
Okay, thank you. And I think that's everything. I can't see any more hands. Thank you very much, Jonathan. Very interesting, and keep up the good work is what we've got to say.
Thank you.
So now we just go on to the Royal Berks National Trust performance report with Andrew Statham.
Thank you. So this is the second time I've been updating this board on our performance. I think it's quite a similar macro picture to last time, including some sustained performance around our staff and reducing staff turnover, which is really indicative of the early outcome we've had from our staff survey results, where we've had the highest response rate ever, and some good early indications of what that says. I think we've also had some strong sustained work on our quality, and we've got a fighting chance of hitting our stretching financial budget, which, given that we've had a prolonged period of industrial action to cope with as well, we're really optimistic about. However, we are still in a really difficult position on some of our operational metrics around what's happening in emergency department, cancer, diagnostics and elective. And we've got a range of action the teams are taking in there. And we've also some asks for partners, especially on the emergency flow element, which I know Sarah was part of a conversation that Don was having with the system on earlier today. More broadly, when we talked about this at board, though, three things that I think is a useful conversation here. The first is about the impact of the sustained period of industrial action is having on performance, and therefore the services we're giving to patients, but also onto staff. And it's really vital that we get a deal on that on both sides to get around the table to do that. The second one was a reflection that as an organisation, as a senior leadership team, we are actually quite concerned that we've got a fighting chance of hitting our money, but the operational performance that we've got, and so we had a real push to our teams that we'll be taking further action on about do we have people who could offer more time in order to, if we spent more money, could we get anywhere? So that ask is live, and we're really focused on that, about doing the right thing for patients at the end of the day. And the third bit that we just reflected on is about how close we are now to next year, and the level of uncertainty on the financial settlement that we've got for next year, and therefore whether we can actually start to book patients in for next year, and indeed on what expectations we're being asked to set. That's caused by further delays to the national planning framework, and the challenges of working as a partnership without clarity on what the priorities are for next year. That's a real concern that we're wrestling with internally and with partners. Again, we need to break through on that front, and take some risk about doing that, because we're going to have to guess to get it right. Last time I also talked a bit about the work we're doing on the new hospital. So 3 things on there. We have been asked now formally by the new hospital team to do a conclusive report on whether it's viable to stay on our current site. And we'll be bringing that through public forums into the spring. We've kicked off some engagement work on what people think would be important about access to an alternative site if that first report says you can't stay. And we're going to be taking that further with some more statistical and data analysis that will kind of add richness on a people front. That's pretty much what I want to say, so happy to take questions on that.
Thank you, Andrew. And certainly, as you say, it's quite something that you might be hitting your budget, but if you're not providing the service that you want to provide, there's quite a strong pull the other way as well. And certainly that is something. Although there's no other questions for Andrew.
Thank you very much for that, Andrew. That was very helpful. I mean, you were talking about some of the uncertainties about the way you actually think strategically. Obviously, there are challenges about finance. I guess built into your thinking is also uncertainty about what's going to happen in terms of government, and what government may or may not do in the future in terms of prioritising the NHS. I guess that's also built into your scenario of uncertainties.
Yes, and the NHS and particularly hospitals features really strongly in all public campaigns. I think other colleagues around the room have more challenge about how they're being prioritised. I think the NHS always comes up really, really strongly for right reasons and also for visible reasons.
No, I think that's a very good point. Yes, certainly compared with local government, I think you would say we're towards the bottom of the list and you're towards the top. Just a somewhat different question, if I may. You talked about the hospital and possible relocation. I guess it's not simply about whether you can stay, it's about whether there's scope to expand on that current site, which is a slightly different matter. I mean, you could conceivably stay and not expand, but if there's any ambition to expand, which I would think there will be, that might be a different matter. It might necessitate going somewhere else.
Yes, absolutely. The questions are: can you build the hospital for the future on the current footprint? And future not being tomorrow, but actually the 50 years after tomorrow. So that that flex. Yeah, absolutely.
Sarah?
I imagine it's not just the scale of the site, it's also the geological conditions and soil conditions that might determine that.
Yes, geological conditions, the kind of the connectivity of what's already there, access conditions, restrictions from what's around us as well. Yeah, we've been asked for a comprehensive and technical report about whether it's the right thing to do to build on that space.
Sarah?
I think just building on the point around kind of the future hospital as well, it's an opportunity for us, and we're doing some work on this at the moment, and we'll hear more about this going forward, around how do we use this as a catalyst to look at what our model of care is as a system across all partners, to then inform what hospital gets built at the end of it, with a view to kind of the theme of my comments around blurring boundaries between services, bringing services closer to home into our communities, in a way that can take a more preventative approach, as well as then making sure we've got the right acute services to meet the acute need that will inevitably come through. So we're really keen to make this feel like a system programme, and there's discussions at the moment ongoing around how we do that.
Thank you, Stephen.
Sorry to come back, David. I just wonder whether you have any sense of how long this process will take of making a decision as to what you do.
We've been asked for that report as quickly as possible. We've committed to the spring, and we've been pushing for a speedy turnaround after that. So our intent is definitely to bring that report into the public space, so that you can see what our advisors are saying to us as we're taking it into the national programme.
Slightly different topic. Read all your statistics. Some of them I don't understand at all. So never mind. Maternity services. Obviously, nationally, there's been a lot of adverse publicity about the safety of maternity services and people's experience of it, and a number of inquiries, unfortunately, into deaths of newborn babies and so on. From what I can interpret of your statistics, you're doing okay at the moment. I just wonder if you could just outline where you think you are in with maternity services.
So we've recently had a CQC inspection of our maternity services, and we've got the initial report, which I can't talk about, but it will be coming out soon. I think we're proud of our maternity services. The team have done a lot about recruitment. They're really focused on the on learning from other people's inspections about, particularly about the maternity assessment, so that people who are experiencing signs of labour get assessed properly and in a timely manner. So we've put a lot of investment and time into that to support that, because we knew that was an area of focus and risk for all units, and that's why we've been looking at that as well. We spend, as you'd expect, we spend a lot of time on maternity assurance, both at our quality committee and actually in the private board, looking at cases that have been referred onwards, and we get good assurance about the safety and quality that we've got there.
Thank you.
So I didn't know you'd have just had your CQC. I wasn't supposed to try to extract information from you. You're not supposed to tell me.
Okay, it doesn't look like. Thank you very much, Andrew. It's certainly very interesting to have these ongoing, things about the Royal Baths and how you're going forward. I find it very interesting and so on. So thank you very much indeed. Now we've got to look at the forward programme. Certainly the forward programme for the next meeting looks fairly full already. I think Madeline did. Sorry, Sarah. Then Stephen.
I was just wondering if we might want to, and I don't think we've got colleagues from Berkshire Healthcare on the meeting today, but whether we might want to rotate between the performance report updates from Royal Berks and Berkshire Healthcare, so we get to see that kind of broader picture. I can take that as an action to speak to colleagues and ask about that, unless you want both on the agenda and want to hear from both every time, but it's already quite full. So just a thought there.
If you can, I think that'd be very useful, very interesting.
It would. Thank you very much, David. I wanted to highlight the fact that we're going to be we're having a report on Marmot, which is great. One thing that I am very keen that we pursue in regard to Marmot is trying to get, this kind of goes back to the point earlier about trying to embed this across the council. I want to try to get the different overview and scrutiny committees to engage with this at an early stage. And in fact, I've suggested to the chair of the Overview and Scrutiny Management Committee that we pursue Marmot as one of the things that comes up, not just at the Health Overview and Scrutiny Committee, but also the community and corporate one. I think it's quite important they have a look at Marmot and start thinking about some of the things as an organisation we can do on Marmot, because clearly, as we were saying in our earlier discussion, this is going to involve lots of parts of the council. So it's truly needs to be a corporate effort. And it's great it's coming here. That will get us started off. But I'm really keen that backbench councillors of all parties have a chance to have an input on this.
Sorry, it's being the whole rather than little parts, which is so important. Ingrid.
Yeah, it's just to say I can take that as an action and make sure that happens. I know we've discussed that already in leadership, so I'll make sure that happens soon.
Thank you very much, Ingrid. Thanks.
Any other points or questions? I think that's everything. So we'll close the meeting at 6:32. Yes. So